Hi. In aesthetic medicine, we're always on the lookout for safe, effective treatments that are low risk, have low downtime, low discomfort levels, and aren't too expensive. Here's a couple of treatments that fail all of those criteria. The first of these is called plasma fibroblast, and the idea behind this is that you cause controlled burns on the skin of the eyelids, of the crow's feet lines, other areas of the face, and that the surrounding normal skin tightens up, and as the burns heal, everything's going to be tightened and lifted. This makes no sense at all. There are high risks of infection, high risks of damage, of overpigmentation, and I think this is a disaster. If you have really loose, redundant skin on the upper eyelids, you can tweak it a tiny bit sometimes with anti-wrinkle medication like botulinum toxin. But if there's loose skin hanging down, the solution is really surgical, and that's blepharoplasty, and that can be done under local anaesthetic. I've had that done about a decade ago, and I have it in posts further down the feet. Another idea are these multiple PDO threads, and this is a synthetic material called polydioxanone, and it's like dissolvable suture material, and the idea is that you insert multiple threads all over the face, and they tighten, they lift, they stimulate collagen. In almost 20 years, I've never seen a single clinical study that shows that these are effective. They are painful, they can be costly, they have risks of infection, of puckering, of extrusion or sticking out of the threads, and I don't see any studies that show they have a long-lasting result worth all the risks and the downtime and the cost. Another one is what's called a BB glow, and this is where somebody microneedles in pigmented solutions into the skin to mimic highlighter, blusher, bronzer and foundation. I think this is an absolute disaster. These products are never meant to go in under the skin. They're meant to just sit on the skin and be wiped off every day as you go to bed. To microneedle them in, to me, seems high risk. Again, a high risk of infection, poor placement, and these just aren't safe procedures, and they may just not look right, and then you're left with really what are tattoos essentially on your face. If you're considering a treatment, stay as safe as possible. See a registered medical practitioner who's going to give you honest and unbiased advice. Have a cooling off period. Just take your time, be measured, do your research, and stay as safe as possible. Take care. Bye.